Hey guys, we are the Patient Link team, and we stumbled upon the problem that there's a big gap between patient and provider's relationship in the communication between visits. This is especially hard for people to receive quality care and better health outcomes since medical staff there's a shortage of medical staff, and this also extends the time between visits. Therefore, we decided to make a solution where patients' data is sent over to providers, so the providers can monitor data and determine if they should change the treatment plan a patient is receiving and whether or not they're actually undergoing the treatment plan that was advised by the providers. So my
The way a patient would enroll in this program is through a recommendation from the provider, and the provider will opt, uh, or rather, the patient will opt into the program. The patient's data will be tracked and sent to a central database, which the providers can access either directly through a site or through an API. So here is an example of the interface a provider would see on the website. For the patient Thomas Foreman, it will display their stats that are being tracked under their current treatment plan. So in this case, we have blood pressure, heart rate, and glucose level monitored over a period of several weeks. The doctor may also choose to update and edit the treatment plan for a patient, and they can prescribe certain medications, add additional instructions as part of the treatment plan, and other things as necessary for the treatment of the patient.
The patient is also able to look at their record and their stats for the day. They can look at their average, minimum, maximum glucose level, blood pressure, which is also divided in systolic and diastolic. And they also have access to their treatment plan in a readable way that lets them look at what they're prescribed, how often, and what their dosage is, and then they can even mark it as complete for the day.
This is very beneficial for particular types of patients, such as people with diabetes, and they have to be monitored across a period of time to make sure their glucose levels are down, and they're basically going through all the treatment that is required for an optimal health outcome. So this is our solution to that. Thank you.